All right, so we are still having people filter in, but we have a lot to get through. So we're just going to get started here. Thank you all so much for being here. I did forget to share my screen like I am supposed to. So let me just pop this up while I give you a brief introduction to what all's going on. All right. Welcome to this special session of Coffee and Tea with IWRC. My name is Stephanie Herman, and I'm the Membership Coordinator and Content Specialist for IWRC. For any new folks, and I know we have some folks out there that are a little bit new to IWRC, IWRC is the International Wildlife Rehab Council. We're a nonprofit that supports wildlife rehabilitators and related professionals through science-based education, networking, publications, standards, things like that. Coffee and Tea are our free monthly seminars to support ongoing learning and connection. And this one is a little bit of a special event due to recent developments, which we'll talk about in a few minutes. We invite all of you to consider supporting us with a donation or joining us as members to help us continue to offer free and low-cost resources for wildlife rehabilitators, just like this event. Members get access to all sorts of helpful things like the Journal of Wildlife Rehabilitation, our full webinar library, all the coffee and tea recordings, discounts on classes and IWRC publications, just a whole lot of stuff. And one thing I just want to mention really quick, because I just can't not, we just this week released our new book about wildlife nutrition. So it's a little off topic, but wildlife nutrition book. This is a book that's going to help you no matter what species you care for, where in the world you are. It's going to help you provide better diets for your patients. So without further ado, I'd really love to introduce our panelists. Our panelists are amazing and from all over the world. I'm going to read off a little bit of their biographies just so you know the backgrounds and just the collection of knowledge that's here at your disposal today. So Ada Liang is a wildlife rehabilitator at the Wildlife Rescue and Research Center in Taiwan and a member of the Board of Supervisors of the Taiwan Wildlife Rehabilitation and Conservation Association. She's involved in wildlife rescue, rehabilitation, and disease surveillance, and is happy to share her team's experience and Taiwan's approach to HPAI preparedness and response. Dr. Colin Salter is the policy lead for WIRES, an Australian wildlife rehabilitation group. They work with the government, landholders, and the broader community to facilitate better outcomes for wildlife and their habitat, and to increase support for those who care for them. They're a social theorist with expertise in how individuals, groups, and communities come to value wildlife, the environment, and connection to country. He has more than 2 decades of experience at top-ranked universities in Australia and internationally, and within the public and not-for-profit sections. Dr. Dana Franzen-Klein is the medical director at the Raptor Center and an assistant professor in the veterinary population medicine department at the University of Minnesota College of Veterinary Medicine. Her duties included providing medical care for the approximately 1,000 raptors that the Raptor Center treats on an annual basis, and maintaining a wellness program for captive educational raptors, prospective research and publications, remote consultations, along with clinical training for students, veterinarians, and wildlife rehabilitators. All right, Dr. Emily Whitmer leads the veterinary care for the Marine Mammal Center rehabilitation hospitals in California. And she was involved in the response to the outbreak of HPAI in marine mammals in Central California this year. Jack Aronian is a One Health strategist, wildlife conservationist, and advocacy filmmaker, recognized for his leadership in global species protection and coalition building. He is the founder of the H5N1 Prevention Center Hub and Initiative, which works to unify avian and wildlife centers, promote biosecurity, and strengthen disease protocol alliances. Jack's award-winning documentaries, presentations, and fundraising have engaged over 185,000 people worldwide and earned accolades from international experts and preservationists, as well as civic and service organizations. Dr. Jean Fair was a scientist in modeling and observations of Earth Systems Group at Los Alamos National Laboratory for 30 years with a focus on epidemiology and animal disease ecology. In October 2025, she became the president and chief scientist for the Global Conservation Institute. Her research has focused on avian influenza in wild birds and strengthening surveillance capabilities for H5N1 around the world, including leading the Avian Zoonotic Disease Network for the Black Sea and Mediterranean Flyway. Dr. Fair is the author of the book Scientific Collaboration Strategies for Successful Research Teams by Johns Hopkins University Press. Dr. Kara Pierce is the director of veterinary services at the Wildlife Center of Virginia, where she oversees the medical care of thousands of native wildlife patients each year while leading the center's veterinary internship, externship, and student training programs. She is a diplomat of the American College of Veterinary Preventative Medicine and a certified wildlife rehabilitator. Emily Meredith has been a wildlife rehabilitator for more than 30 years. She has worked for many organizations across the United States. Her experience encompasses a wide range of species, including large mammals and pelagic birds. Emily is a member of NWRA and IWRC and serves on the board of Washington Wildlife Rehabilitators Association as treasurer. She is a certified wildlife rehabilitator and enjoys anything about owls. Mirella D'Elia is a wildlife veterinarian and wildlife specialist at Iuca Environmental Solutions Consulting in Brazil. She has experience leading animal response teams during environmental emergencies. Her current work focuses on operational planning and technical support for wildlife rehabilitation centers and emergency preparedness, including responses to highly pathogenic avian influenza. Guided by the One Health approach, she contributes to wildlife conservation and emergency preparedness initiatives and that strengthen the human-animal environment health interface in Brazil. Dr. Nikki Rosenhagen is the full-time clinical veterinarian at the Paws Wildlife Rehabilitation Center in Snohomish, Washington, where she is involved in the medical and surgical care of nearly 5,000 patients annually. She speaks at wildlife and veterinary conventions nationally and internationally and teaches the online wildlife medicine course for private practitioners through the National Wildlife Rehabilitation Association. Dr. Simone Vitali is a veterinarian with the Wildlife Health Australia, a national body that advances wildlife health for a healthier future for all. Simone heads the emergencies programs team, working with others to safeguard the health, welfare, and biodiversity of Australian wildlife in all emergencies using a collaborative One Health approach, supporting national and jurisdictional preparedness for the arrival of H5 bird flu into Australia has been a major focus of hers in recent years. And Dr. Wendy Puryear is a scientist at Tufts University studying how viruses are maintained, spread, and evolve in wild animals. A major focus of her work is to understand how viruses survive, adapt, and persist from one host to the next, centered heavily on pinnipeds, seabirds, and the coastal environment. She works closely with wildlife facilities, local state government, and academic partners to support influenza surveillance efforts and response. What is avian influenza and why are we here? So, highly pathogenic avian influenza, or HPAI virus, is also known as H5 avian influenza or bird flu, H5N1. There's a lot of names for it, but it's a disease of great concern to wildlife rehabilitators worldwide. It spreads quickly, it has a high mortality in many species, and it's got a zoonotic potential, which means it can infect people. As of June 2026, H5N1 avian influenza strains have been detected on every continent and had significant impacts on wild bird populations and the poultry industry. The virus has been persistent in wild populations since 2020. While the frequency with which the virus is detected, it varies regionally over time. It might, peak in some areas and then drop away. The threat it poses to wildlife rehabilitation efforts appears to be ongoing for the foreseeable future. It doesn't appear to be going away. Most detections of HPAI in wild animals occur in waterfowl, which are considered the reservoir species for the virus. Some birds can be infected with HPAI without showing any clinical symptoms. In other words, they can be asymptomatic. Mass mortality events and symptomatic illness, in wild species most often occurs in seabirds, shorebirds, raptors, and scavenging species like gulls, ravens, and crows. but all avian species are considered susceptible. Spillover into mammals has occurred as well, resulting in mortality of marine mammals and scavenging species like foxes, with sporadic detections in many other mammals, including dairy cattle. Felines or cats are highly susceptible, with mortalities in wild, captive, and domestic cats. We also have at least one documented case where the virus was transmitted from infected birds to mammals in a rehabilitation setting, which resulted in the death of the infected patients. Secondary transmission, which means transmission between non-host species, in this case, mostly we're talking about mammals to mammals, has been recorded as well. And a strain of the virus may be establishing itself in marine mammal populations in South America. The situation and the virus changes frequently. There's a lot more to say about it, but we're just doing a brief snippet today. Today, our goal is to go beyond the basic facts about the disease, and our conversation will assume general knowledge about the virus and situation. So if you're looking for an overview of avian influenza, as well as for rehab protocols that are generally recommended, IWRC has a summary of recommended procedures that you can start with, and we'll also provide links to a number of other resources in our follow-up email after this event. So today for this discussion, we want to highlight the efforts of wildlife rehabilitators who have adapted to the presence of this virus in their region. Our panelists will be sharing their experiences in hopes that we can all walk away with a better understanding of how to protect ourselves, our patients, and our wild populations. It's also really important to remember that panelists will be sharing their experiences and their local, their work within their local regulations, and that can vary. Every country and region has its own biosecurity protocols, legal reporting requirements, wildlife authority guidelines or regulations. Rehabbers must follow their own national and local protocol first, regardless of whether or not what you are permitted to do aligns with what the rehabilitators are doing in other regions. You need to follow your own local guidelines. And while we want this discussion to be valuable for everyone, we also recognize that many of you are here because avian influenza was just confirmed in southern Australia this July. Since the situation there is still developing, we'd like to start off by asking Dr. Simone Vitali of Wildlife Health Australia to share the current status of the disease in Australia. Simone, you're up.
Thanks very much, Stephanie. Can you hear me?
I can.
Wonderful. So yes, we're right at the start of the emergence of H5 bird flu in Oceania, and new developments are occurring on a daily basis since the first confirmed report, which was here in Western Australia, where I am, on the 20th of June. After the initial detections in Western Australia, additional cases were detected in South Australia, followed by New South Wales, Queensland and Victoria. So we're now nearly 7 weeks after the first case was confirmed, and only 3 Australian jurisdictions have no confirmed cases. That's Tasmania in the south, Northern Territory in the north, and the Australian Capital Territory, which is inland. Our eastern neighbours in New Zealand have also had 2 detections, including one in a predator raptor species, both of which were reported in mid-July. To date, the detections in Australia have been in coastal locations in the southern half of the continent. The initial cases involved individual giant petrels and brown skua, which are migratory seabird species known to disperse to Australian waters from the subantarctic, and genetic analysis showed that those cases represented multiple individual detections of strains most similar to those that caused mortalities in the subantarctic late last year on Heard Island, which is situated 4,000 kilometres to the southeast of mainland Australia. However, we now have confirmed cases in resident seabirds in most states, and those confirmations have been in 2 species, greater crested terns and silver gulls, which are both very common in coastal areas of Australia. And last week we got confirmation of the first H5 bird flu mass mortality event in Australia, which involved over 80 greater crested terns in South Australia. So every day is bringing new developments at the moment, but at this stage, neither Australia nor New Zealand has reported cases in poultry or in mammals of any kind. We've been really lucky to have had the time we've had for preparedness and planning for H5 bird flu in our region, and both government and non-government have invested a lot of effort in the last 3 years or so into raising awareness, planning, training and surveillance. Since the detections 7 weeks ago, the focus has shifted to activating response plans, coordinating activities across sectors within jurisdictions, and informing the huge range of stakeholders of what these detections might mean for them. There's long been recognition based on international experience that we can't prevent the arrival and spread of H5 bird flu via wildlife movements, and that healthy habitats and strong populations are what will give our species the best chance to withstand its impacts. So the focus for wildlife is now on supporting species recovery, building resilient, strong ecosystems, and reducing other threats to wildlife. We expect that H5 bird flu will now remain in Oceania and require continued monitoring and management as it does elsewhere in the world. Our current messaging to the general public is avoid, record, report. So avoid contact with suspicious wildlife cases, record what you see and report it to authorities via our emergency animal disease hotline. But it's clear that wildlife workers, including rehabilitators, are going to require more targeted information and guidance on adapting their risk management to the situation. So I really welcome this opportunity for them to hear directly from others in the field about their experiences with H5 bird flu, many of whom have been advising us and shaping our preparedness and planning for several years now. And on that note, I'd like to take this opportunity to thank you all very much for being so generous with your advice, your protocols, and your experiences, which are absolutely the bedrock of the preparatory work and resources that are now available in Australia and in Oceania. So thank you very much.
Thank you, Simone. And yeah, just to echo that, uh, we don't know anything unless we share it with each other. So you guys are doing important work. So let's start our conversation off. All right, I know that's some prep, but I think we're here now. And the first question that I'd really like to ask you guys is, what is different about the way you perform your work now versus before avian influenza, the outbreak reached your region? And there's lots of like places where we can dig in, but I'm looking for just a broad overview of the biggest things that have changed. And let's start with Dr. Rosenhagen.
Okay, so the biggest thing that has changed with the way that we function, right? That's what you're asking. At our facility now, we are fortunate enough that we have the space to fully separate all water birds. Those are the ones that we're most concerned about being the asymptomatic carriers. When we have animals that are admitted, birds that are admitted, whether they are birds of prey or water birds, if they are at all suspicious, neurologic signs, corneal edema, things like that, and there's not an obvious history of trauma, of toxin, something like lead toxicity or something like that, those animals move to a completely separate area. So our water birds move outdoors. We have a separate tent. That's our HPAI tent. Those animals never come in the building. They're examined by a rehabilitator or a veterinarian as needed. If they're confirmed to be strongly suspicious, we euthanize. If they're not showing overt signs, there is a cause history of trauma or something that accounts for it, then those animals are still housed in a completely separate part of the building. We wear PPE. Those animals never share enclosures. They never share materials with any other animals in our facility. They're housed completely in a different building with pools and things like that. And I will say that we have been incredibly successful. To our knowledge, we have not changed our admissions at all the whole time that HPAI has been here. We haven't had to turn patients away or decrease our numbers at all. We've been seeing the exact same patients. And to our knowledge, we haven't had any animals break in care. So we have been really successful at keeping those animals isolated and protecting the other animals in care.
Thank you. Dr. Pierce, would you mind chatting about Wildlife Center of Virginia?
Yeah, so a lot of the similar things to what Nikki said, with the one caveat being we do not currently have the luxury of many different spaces. So we have instituted more of a quarantine in place, I guess. And anything associated with that animal, we're a lot more careful about cross-contamination and what is touching what. And we've instituted so much additional PPE, which we'll get to, adds a lot of cost, it turns out. Our operations people are always like, you need more gowns? I was like, yes, we need more gowns. It does add up financially very quickly. So yeah, because of that, because we don't have multiple spaces to kind of split things up in, we kind of changed our triage protocols that high risk species get triaged outside, but they ultimately do, if they don't have the symptoms Nikki's describing, they ultimately do get to come inside and proceed like a normal patient. But we've kind of treated every patient like their own little isolation, basically, right? So they have everything with them that they require. And we kind of isolate them as their own little unit, which was stressful at first because, I'd hear about other places being like, well, I put the high risk birds in this room and this in this room and this in that room. I was like, but I have one room. So I was very, very stressed at first that I couldn't like meet that standard, I guess, if that makes sense. And we found creative workarounds and using other rooms here and there when we have a bird where I'm like, if I have a bald eagle come in and it doesn't have a reason for being there, it's certainly not going in the room with the other birds until I get an HPAI test back. But that's not, it's just not always practical in every day and everything we do. And similar to Nikki, I'm going to knock on wood right now because we have a lot of waterfowl right now. But we have also been very successful with the measures we've implemented, kind of containing each animal with itself, even though they are often in the same room. And that has been very successful. I know we've had positive birds come through. We participate in lots of studies where I get results back like 6 weeks later where I'm like, oh, there was a positive bird in that room. And none of the other birds have come down with it. So I felt pretty good about that. Yeah, that's my kind of brief version, but happy to talk more about all those things.
Yeah, we're definitely going to start picking this apart a little bit. Dr. Franson Klein, would you mind?
Yes, of course. Thank you. So we have gone through lots of different variations of our quarantine protocols here at the Raptor Center. We're in Minnesota, so the central part of the United States. And then everyone's going to have a different plan that works for them. It also really varies a lot depending on your organization's risk tolerance as well. So what risks are you willing to take and what risks are you not willing to take? So we only see raptors, we only see birds of prey, and we also have a collection of captive educational birds in our same facility. We only have one building that we work out of. It's 2 separate floors. The wild birds are in the basement, the education birds are upstairs, but it's still just one building. So back in 2022, when we first were dealing with this, we were kind of starting fresh. This level of biosecurity was all new to us. We actually took over an abandoned building on campus and moved all new admissions out of our main building. We used full PPE, and then we basically fundraised some emergency funds to be able to PCR test every bird on admission. And we did extensive quarantine, multiple quarantines, and kind of until we figured things out and kind of figured out a system. Currently what we do, so we have pursued grant funding to be able to continue to PCR test every bird on admission, and every bird is quarantined in our main building, but in a separate room until we get negative PCR tests. And that's because we have the captive birds that we care for. We just can't take the risk of exposing those captive birds. So that's the level of precaution we've taken. We do all of our admissions, all of our recheck exams on birds that have pending flu tests in a separate room with completely separate equipment and wearing PPE. Doing appropriate biosecurity and working from clean to dirty and paying attention to what you're touching and not contaminating things you don't want to. It sounds like it should be pretty easy, but when you're working with a live patient and focusing on that patient, it is so incredibly easy to touch things you're not supposed to. And then that's potentially contaminated with virus and becomes a risk. So we did do a trial of maybe doing intakes in low risk season in our main space, but we realized it was just too risky because it's too hard. So having a separate space, separate equipment when you can, even if it's something outside, is very helpful. So we do all in, all out quarantine, and they just get quarantined until they get a negative test. If there has been an exposure within that quarantine group where there was a positive bird, then we do a risk assessment and decide, okay, do you need to stay in quarantine? Do you get repeat tested or not? So that's the quick version of kind of where we've progressed and where we're at now.
Wonderful. Thank you. Ada, would you like to share what's going on at your center?
Okay, the winter and spring are Taiwan's migratory bird season each year, and so our staff always wear a minimized like gloves and masks from the outset while triaging this water bird. Other bird species are kept from getting too close to the same area, and we have 2 negative pressure isolation room in our facility. So on intake, a bird placed into the one of these isolation room, and we have also designed separate traffic route so that the migratory birds with suspect symptoms can be brought into the isolation room. And all waste generated by this bird is handled exclusive as medical waste, and equipment inside this room, like scale, padding, cages, follow the in but not out rule, is never shared with others. So we try to use disable supplies wherever possible. Anything that can be disposed of is first soaked in the bleach or the bicorn. So we run our own in-house screening and also send a sample to the national reference laboratories. So we have a small PCR machine. They can detect the avian influenza, though it cannot determine the subtype. So if our in-house test is negative, the bird is transferred to another room. If the positive, it will stay in the original room while waiting for the confirmation from the national reference laboratory. And we will immediately raise our biosecurity and PPE as if the case were confirmed positive. The positive case, we will put on the N95 isolation gown and face shield. So this is what we do in Taiwan.
Thank you. Dr. Whitmer, considering marine mammals aren't like the primary species affected, but have definitely been affected notably over the last couple years, has the Marine Mammal Center changed anything about your protocols?
Hi, everyone. Pleasure to be here. I'm with the Marine Mammal Center in California. We also have a hospital in Hawaii. There was an outbreak of HPAI in elephant seals, California sea lions, and sea otters in California earlier this year, which was one of several North American marine mammal outbreaks over the past decade or so. Thankfully, this one was isolated and did not spread mammal to mammal in a significant way. It was all direct bird to mammal transmissions without adaptations for spread among the marine mammals. So we got quite lucky, unlike South America in 22, 23. It was our facility's first time dealing with it in our range. And so I think for many of you who've been dealing with HPAI and birds for decades or years, and you're used to all of this, we were sort of doing it for the first time. And so lots of empathy with my Australian colleagues. We also had time to prep, but it never feels like the prep you do is quite enough. We do have an open biosecurity facility. All of our animals are housed together, and we do not have, on a routine basis, we don't have effective quarantine. So we did pause our operations for a couple of weeks when the outbreak first started in February, so that we would be able to establish a quarantine procedure and human safety. So we just took a pause. About 2 weeks later, we were able to reopen to FOCID admissions. We continued to admit otariids, but reopened to FOCID the elephant seals, which were the main outbreak, and with quarantine and PPE operations in place.
Thank you.
I'll just add that, throughout North America, as our colleagues in Taiwan are noting, we have a lot of seasonality. And so we're looking at doing differences in quarantine and testing as our seasonal risk assessment changes.
Excellent. Thanks. Dr. D'Elia, you've been dealing with the South American marine mammal situation for quite some time. Do you have anything to add or any differences that you see between the work you did prior to the outbreaks and now? Morella?
Oh, sorry.
That's
Sorry.
okay. Would you like to share?
He was forming that question. Well, at our facilities, we don't usually receive mammals, so we didn't have the opportunity to work with these groups in during the HPAI occurrence. But we had a lot of discussions with the main organizations that work with these groups to establish some protocols that we could address to animals that would present some clinical symptoms on shore. And but the main, how can I say, the main what we most provided for the official veterinary agencies, we have to work in arrangement with them. So our main concern was that none of symptomatic mammals were going to enter the facilities of any organizations. So we established that the euthanasia would be proceeded on shore for those animals to make sure that we would keep the biosecurity of all the organizations that work with mammals on Brazil. So we participated in establishing the protocols for those cases.
And how was your bird work affected as well?
Yes, I think that one thing that we quite have a challenge is that the entire admission protocol on land was maintained, and we established a quarantine for receiving those birds from main groups. But however, certain activities such as the unloading of birds by helicopter, because we work offshore with platforms, these activities were suspended for safety reasons. So, given that it's a zoonotic disease with significant socioeconomic impact, and there was also a risk of exposure for helicopter crew members sharing flights with seabirds. So consequently, landing were suspended for a long time, and it was necessary to perform euthanasia and investigate suspected cases. We had a veterinarian from our team would board the platforms to carry out the procedures and collect some samples to address the official governmental agency that would proceed the analysis. So it was also necessary to instruct these individuals on proper donning and doffing procedures, as well on disinfecting operational areas whenever necessary. So I think this illustrates how joint cooperation is extremely important for these episodics such as avian influenza scenarios.
Thank you. So, Dr. Pierce, you had mentioned about PPE. I wonder if you would mind going into more detail about what the protective equipment you're using is and just expand on that a little bit more.
Yeah, and I know we probably all have our own, our own different protocols. We, since COVID, have continued to wear masks full time in our clinic with everything. That never went away, but we've maintained that with avian influenza, and that's just a standard now. If you're in the hospital, and you'll have your K95 on or your N95 depending. So we have maintained that. And then we use either gowns or Tyvek suits, depending on the species and the level of contamination that is going to be involved. We also, and maybe this is silly, but it makes me feel better, we similar to the Raptor Center, see a lot of raptors, but I simply cannot afford to have a pair of raptor gloves for every single patient that comes into our facility to stay with them. So we actually have put like the plastic rectal palpation sleeves over gloves that are shared. Does it work 100% of the time? No. Do they tear sometimes? Yes. But is it mitigating some risk? I hope so. Do I have any evidence to prove that? No. But does it help me feel a little better? Yes. So we go through a lot of those now. We change them out between patients. Initially at the start, we were like trying to disinfect the gloves, but I don't know if anyone else has experienced this, but it breaks gloves down really quickly. And I was getting a giant pile of instant reports on my desk every Monday of people who were taloned through gloves all weekend long. So we realized pretty quickly that wasn't going to be safe for everyone. And I think that's kind of what I've taken away from all of this the most, is the protocol that works is the best for your facility is the one that your staff can like work within and follow is really what I have learned. And that's going to be different for everyone here, of course, but those are kind of our basic PPE, I guess, for all large birds.
Yeah. And Jack, you have something to add?
Yes. So, going off what Dr. Pierce just said, from the experience I've had with talking with other centers, it really is all about what the staff is able to handle and sort of communicating that with the rest of the center and making your preventive strategies go according to that. So for some centers, that can be as simple as foot baths, but with the proper funding and with the proper communication with the rest of your center regarding donations and just the feasibility of each potential strategy, you can go up and use many different things such as PPEs like was just mentioned, and it really is all about the individual center and their needs, and it's really important to sort of mitigate the risk as much as you can, but at the same time do what's feasible for your own specific center. So I think that's really important, Dr. Pierce. Agree with that.
That's a good point. Does anybody use any PPE aside from what Dr. Pierce brought up? For example, I'm thinking things like foot covers or, air filtration is not really PPE, but other protections you guys have in place that might go beyond PPE as well?
I will add, actually, I did fundraise for like a hospital grade air purifier for my one room. Again, you have to remember to change the filters, it turns out. So that's important to add that to your list of maintenance things. But I will add, yes, we do. We, similar to the Raptor Center, have a population of education ambassadors as well. So actually, the people who have had to worry more about coming into the hospital are the ones who work with those ambassadors. So if any of the ambassador team needs to enter the hospital for any reason, they're the ones putting on foot covers, basically. And they basically just avoid the hospital now altogether, which is kind of sad because they're nice people that I like to see. But if they have to come in for any reason, we do use foot covers and things like that for them. And now I'll stop talking. Someone else's turn.
No, that's a great comment. Thank you. Emily.
Yeah, so when you are entering our waterfowl area, which is a whole separate little room, we put on PPE, boots, or shoe covers, and etc. If you're going to be working with water, you're wearing an apron, etc. for the splashing, and it's masks. So we're all just gowned up in that area and eye protection if needed for those areas, and then you switch out of it when you leave that area.
Any other PPE or even other controls? Is anybody segmenting their staff or anything like that? I see some nodding, some maybe. Yes, Marilla.
Well, we install some how can I say inner lines in the tents to improve insulation and curtains to separate the areas. but this raised the temperature inside the tent. So in the winter, this wouldn't be a problem for sure. But in the summer, we saw that it had a negative impact on the well-being of the team and also the birds. So despite of the biosecurity importance of this kind of action, we need to foresee all the consequences that may have for the team and the birds also. So we gotta think about exchange this kind of inner lines for some procedures, for example, for trying to do a better decontamination inside the tent, so we can exchange some actions trying to make some adaptation for the biosecurity criteria inside the tents.
Dr. Franzen Klein.
We've done very similar things to everyone. One thing that I wanted to add is that for our public education space, we actually put foot dips in that the general public have to walk through. So it's like a squishy mat. I don't know what else to call it, but they're like, we get them from the farm store. They're a squishy mat so that the disinfectant, we use rescue, so an accelerated hydrogen peroxide that is in the mat, and then it has a solid surface. So if you get grass clippings or whatever on it, it's easy to wipe it off so that it stays effective. And then everyone who comes in our building either has to squish in the squishy mat or put shoe covers on. And then staff also have separate set of shoes for upstairs and downstairs. We also do fitted respirators during our high risk season. That's an additional requirement we have from the university with the additional health oversights and stuff. Back in 2022, when it started, we partnered with the Minnesota Department of Health and tested the staff who were admitting the positive birds to see if any of our staff developed titers to avian influenza, and no one did. So it seems to be working pretty effective.
Thank you. So has anybody changed the way that they move patients through their facility? I know Dr. Franzen Klein talked about having a separate facility. Dr. Rosenhagen talked about having an outdoor tent. Are there other changes that have happened in the way you sort of process and move animals and people through your building? And let's see. Ada, do you have anything to add on that, to the way animals move?
No, but we do have the another traffic rule to transfer the animal to separate with other birds. That's what we do.
Mm-hmm. Okay,
Yeah.
so separate rooms for the newer animals then. Yeah. Does anybody else have anything you want to add to that? Mirella.
I think that the most important thing that we took account on, it was that the team conduct a case-by-case assessment, because most of the facilities in Brazil, they don't have area to establish a tent or quarantine in a perfect way or scenario, all the birds. So every facility decided whether the animal would be admitted through the tent or directly to the clinic. I think pretty similar to what Nikki said, considering the species and the susceptibility of it to influenza. But I think it's always important to bear in mind that these decisions must be taken into account the facility's capacity and the flow of the operations. So I think each facility took the best operation work system that was possible regarding and trying to keep the biosecurity on better status that they could.
Mm-hmm. Yeah. It's interesting because so my facility is very physically small. It's a very small building, but like 5,000 animals move through it in a year, or my previous facility. And when we were at our peak with avian influenza, we did need to move our admissions outside, but we also had to close to certain species because we didn't have the capability to isolate them or just keep our other patients safe. And so I'm wondering if anybody, I know Dr. Rosenhagen, you mentioned that you maybe do triage and make euthanasia decisions a little bit differently now with avian influenza present. Does anybody else have sort of changed their protocols around accepting animals or around the animals that you choose to keep? No one has. Okay, I'll let you think about that for a minute. Jack, did you have something?
Hands up there, Stephanie. Has Jack got?
Yeah, I was just gonna pop over to Jack. I think you had something to say about the last part of the conversation.
Yeah. So the last part of the question about intake with different patients coming in and having to sort of re-navigate the way your center runs during these times. A center very nearby to me actually is working on currently enclosing their pond to prevent aerial visitors from coming in, landing, and infecting the other birds and other members of their center. So they've had to reconfigure their center in quite a bit of different ways to navigate the threat, and at the same time they were able to sort of circumnavigate some of the danger by doing that while also sort of maintaining some passageway of their patrons coming in and learning about birds and coming to the center in general. So certain steps had to be taken, but there were some ways to get around that. But, yeah.
And I do just want to address Paula. Unfortunately, we're not able to take live questions right now. I know you have your hand up. You're welcome to put it in the chat. And if it's something that we're able to get to, we will, but we just have a lot to go through today. So Dr. Whitmer.
Just to address your previous question, I think we certainly have had to make decisions about species that we effectively cannot quarantine because of how they're housed or their needs. And those animals, we made decisions that we would, during the period of the outbreak that we were working with in marine mammals, we decided that we would euthanize those animals if they were injured or ill and needed rehabilitation, and that it was too great a risk to our patient population to bring them into care. Similarly, we made decisions about neurologic animals or animals that were high suspicion for influenza, particularly given the mortality rate in the marine mammals. And so we've certainly had to make those hard decisions, and having explicit protocols for our volunteer and staff communities was really important from the outset, from expectations for everyone about those choices.
Thank you. Yeah, I think that those decisions are very hard, and it might also be many of our panelists are coming from larger, more resourced facilities. We did try to get some folks with smaller or even independent rehabilitators to come, but it is a very busy time right now. And if you're a one-man show, you can't necessarily take a few hours off. So I will just say, relating to all of this that we're talking about, if you're hearing what people are saying and you're thinking there is no way I can physically do this in my facility or with my resources, it's not a condemnation or a bad thing to know where your limits are. And I just think it's really important to highlight that we are talking to people with a lot of resources, and your facility may have more restrictions. It is better to keep yourself and the patients that you can care for safe than to try to help everything and end up with an outbreak that potentially affects you, any domestic animals, any other patients, and having to potentially close your doors because of that. So I just wanted to bring that up because I think it's just a slightly different scenario for a lot of the people who might be listening right now. But I do want to touch back on something that Dr. Franzen Klein brought up earlier about testing. Now, it sounds like you guys raised resources to be able to test a lot of animals. So could you talk a little bit about that process? How long did it take? What sorts of tests were you doing? Did you do it for every bird or just some birds?
Yeah, sure. So We are associated with a university. We don't get funding from the university, or we don't get direct funding from the state, just like other organizations in the US. But our state in Minnesota has a grant funding program that's actually lottery money. So stuff from the lottery, extra funds are specifically directed towards Minnesota's natural resources and projects that support that. So we've applied for grant funding through that program, and that has been able to fund our PCR testing. It funded our patient side flu detect test when we were trialing that. We did a study, found that the flu detect test was not effective in raptors. There's lots of false negatives on that test. And then it also funds our PPE and disinfectant as well. So that's the route that we went, and we partnered with another professor at the university to get access to the PCR tests. I know Dr. Pierce probably has other experience because I think she's partnered with other collaborators to get access to PCR testing.
Yeah,
Would you like to talk about that?
I can, yes.
Yeah.
And so when, this first all started, you had really had to know someone who could get you into a study so you could get a lot of free testing basically if possible. And initially I didn't know anyone and it was stressful. And any test I wanted to run, we had to pay for through our local lab. And they only run them on certain days a week. And I would have to personally drive it there and have it there before 8 o'clock if they were going to run it. It was so challenging. And I still do use that option because they can get me test results usually by the end of the day. So if I have a patient that I need to know more quickly, I'll do that still. But now we are able to partner with different research projects and send in large batches of samples. And we send in hundreds of samples every month. We have someone who it basically is a large chunk of her job at this point is collecting, processing samples, shipping them off. So that's a research project with a group called TGen, and they will test basically anything that comes through our facility. So that's super, super great. Now, you don't get results back immediately, of course, but it is still very valuable information. And I think it helps us recognize patterns as well and learn more, even if it's, that animal is euthanized by the time we get the information back. It is really, really helpful. So I don't know what, all of those things are out there in the world, but trying to look for the people who you can partner with to help you is very, very useful. And that has been incredibly useful for us.
Oh, wonderful. Does anyone else have anything that you'd like to add on the topic of testing? Okay. One question that comes up a lot is whether or not symptoms are very definitive, and we are generally told that it's not, and that it's really hard to tell whether or not the symptoms can be, just clinically look at a patient and say, oh, this is that or isn't that. And so I'm wondering if anybody has seen any trends or if it really is just, you never know. Dr. Franzen Klein?
So we work just with raptors, so just birds of prey. So there's always going to be differences between species, of course, and our North American species are different from species in other parts of the world as well. We have found in our raptors that if they are showing clinical signs, generally the clinical signs they are showing localized to the central nervous system. However, I cannot tell apart a bird that has HPAI versus a bird that has West Nile virus infection versus really bad head trauma versus lead toxicity. I've had lead toxicity, really bad lead toxicity birds look just like a flu bird. And I'm working on a clinical science paper to kind of summarize that data. And we have had several birds that were asymptomatic and they test positive, even in our raptor species. So clinical signs can be helpful in your triage, and they are definitely a great tool to build into your testing protocol. So maybe you triage out birds that are showing clinical signs and you do not put your testing resources towards those birds. And you put your testing resources towards birds that are may be questionable or you want to admit to the hospital. It's a useful tool, but it's not a guarantee.
Thank you. That was really helpful. Dr. Rosenhagen. Oh, sorry.
Sorry. Yes, echoing definitely what Dr. Dana said, that there is a ton of overlap. Neurologic signs are really challenging. What I will say is that I feel pretty confident with our water birds, and particularly ducks and geese of lots of different species, when they have bilateral corneal edema. It seems like that is almost always a home run when it comes to HPAI. Very rarely do we see some other pathology, some other etiology cause bilateral corneal edema, especially in conjunction with neurologic signs. So when we see that, we feel pretty confident. We're just going to go ahead and euthanize those guys. Again, I don't know that we've really seen much of that or any of that in raptors or passerines or anything like that, but in our water birds and our ducks and geese in particular, that's a pretty consistent positive.
Thank you. Dr. Salter.
Yeah, one of the first cases in Australia was in care for 6 days before they realised that the bird might have H5. So it's important to note that the symptoms are often difficult to note, and these were very experienced rehabilitators as well. And I think that's an important message for most of us to take on, that it's not always clear. We might not know, so we have to act with the utmost precaution.
Absolutely. Yeah, unfortunately, you might have these occasional species that have some of these signs that make you think they're pretty sure they have them, but there's no way to look at a bird and say it definitely doesn't have it, is what I'm hearing. Yeah. Okay. Thank you, guys. Okay. So I wanted to ask about sort of the public communication, and if you have experience with giving out instructions or potentially advising rescuers differently when HPAI is a possibility versus, before. So what does the public communication side look like? And I'm wondering if we could start with Dr. D'Elia.
Is that me?
Yeah, oh, I'm sorry. Am I saying it wrong? I'm so sorry.
No, sorry. It's because I used to be called Delia, and Delia just a little different for me. So sometimes
okay, I'm sorry about that.
That's great. Here in Brazil, our communication, we focused on training environmental agents on shore because they were the how can I say, the first people to see many of those birds on shore. So we just want to make sure that they would use proper PPE and they would care of those birds in a safer way until they get to our facilities. So we try to train those environmental agents onshore and offshore. As I said, we trained the technicians that were responsible for providing initial care to those birds on offshore platforms. So we addressed many recommendations because we also had some restrictions on platforms regarding those products that we usually use in our clinics, but are not allowed on platforms for security reasons. So we had to adapt a lot of the instructions so they could handle with some procedures that usually we used to take care of, because we would go on the platforms to proceed the initial procedures with the birds, and as I said, we were not allowed to do that anymore. So all of these activities were suspended, and the birds could not be evaluated and unloaded. So this just was very distressful for us, because we knew that we had a lot of birds that would die on the platforms that we couldn't assist because we were not allowed to. So we just make sure that the procedures regarding the carcass of the birds were properly, how can I say, were properly taken care of to unload them and to give the proper treatment for biosecurity reasons. So we had a lot of challenges regarding the platforms, but after just like 1.5 or 2 years that they allowed us to take back our activities on shore on the platforms offshore. So we had a lot of challenges about communications with them, but I think we had success on that. But something that I would like to say is that sometimes even if we are great communicators, sometimes some informations are not obvious for everybody. So we had on a situation that we had a seabird, a booby with clinical symptoms that probably had crushed the platform, but they put the cage, how can I say, the transportation cage inside the ambulatory, the clinic when they used to attend people, so the humans. So this kind of challenge that we have, that we needed to make sure that the birds wouldn't be in the same place where they took care or carry on the clinics of people from the platform. So we had a lot to discuss with them, and we learned a lot from this experience as well.
Yeah. Yeah, lots of potential for cross communication. Ada, how have your communications with the public changed for your program?
If the HPAI is detected, Taiwan Disease Control Authority will carry out a regional public outreach. So our rehabilitation just focus on wildlife rehabilitations and follow the guidance of a responsible authority. So we do not currently communicate directly with the public.
I see. Okay. Let's see. Emily, do you have anything to add about how your program is communicating with the public?
Me?
Yeah.
Okay. There's another.
Oh, sorry, other Emily.
So our state definitely sent out a lot of information about large quantities of birds being dead for people not to go into the field and try to collect them, et cetera, et cetera. We definitely discussed with people over the phone when they're bringing us animals. They'll ask us, we talk about PPE, being safe, making sure that they aren't putting themselves at risk. But most people have just been like, oh no, I'll put on gloves and mask and bring the birds in. The state, there was at one point where they were saying nobody should be rescuing wildlife. And I'm like, what? People are going to do it. So you should tell them how to do it safely. So we just kind of pivoted to that and talked about PPE. And this is the spring and the fall. We don't really talk about in the summer as much. People might ask us, but we just don't see much at all as far as signs in the summer. And we see it, and it's interesting because we're seeing it kind of be more prevalent in cackling geese than any other species that we see, which I think is interesting. And they just seem to get way sicker with it too. But we just tell them to be aware and are, promoting the fact that they should be reporting large die-offs to the state and not getting involved. But the one-off animal that they're rescuing, they just got hit by a car or something like that, just wearing PPE and then bringing it in.
Yeah. Dr. Fair.
Yeah, hello. So this is really an interesting question, because one of the things on the science side that we've been working with a lot of countries like Malaysia and Cambodia they had their H5N1 outbreak, which was in humans as well. a lot of mis and disinformation. And so learning how to be proactive in that and learning how to respond to both, yeah, mis and disinformation that swirls around, particularly avian influenza all over the world, but learning techniques for that so that you're not just ignoring it per se, but you're putting out not necessarily just the facts that would combat that, but trying to do it in a proactive way and gaining that trust beforehand so that people can teaching people to identify mis and disinformation, before they see it, was an important thing that we changed and helped some other countries do as well.
Thank you. That's a really good point, Dr. Fair. Jack.
Yeah.
Oh, wait, Jack. Also, could you speak up a little bit, or volume's a little bit low?
Is it still low, or is this any better?
It's just that's better, but it's just a little low.
Okay, one sec. Let me fix that.
While you work on that, actually, let's hop to Dr. Salter, and we'll come right back to you, Jack.
Okay, sounds great.
Okay. Oh, actually, it's already better.
So WISE is a member-based organisation. We have over 4,000 members in New South Wales, so the east coast of Australia. And we send out regular communications to members, but we also send out information to public on our social media channels, and we have some definitive information on our website. We always point back to government resources. So, for example, in terms of PPE processes, we point back to Wildlife Health Australia, and Simone will know that they've got well-established protocols there. We also point back to state government as the lead agencies directing the response here. And they've just released new videos this week specifically for the sector on what HPAI is, how you should be responding, what some of the concerns are as well. So because we're in this fluid stage at the moment, there's a lot more resources being developed as we sort of work with government to determine what their requirements of us are as well.
Yeah, I imagine there's a lot that's going to change over the next 6 months or so. Jack, thanks for fixing your audio. I'm sorry to have skipped over.
Oh, of course. Is this better?
That's much better, yes.
Okay, awesome. So we have a hub called the H5N1 Prevention Center Hub, and it's a collaborative hub for different centers and clinics to share their protocols and their experience and get support and resources in general. So the hub has these centers from all around the United States, over 70, and they share the preventive strategies on it. And these preventive strategies are specifically how to get information out to the public. And from what they've said, some of their most effective strategies are anything from speaking directly to people in the hub, to radio, to Instagram posts, to, in fact, going on Facebook Live and giving presentations there. So it's a huge variety of different things can be done to get stuff out to the public. And it's super important that each center tries out as many different things as possible, because everyone's trying to combat this virus in different ways, and everyone has to find the best. Each center has their own specific needs and ways to get it out there. So
thank you.
Yeah.
All right. We are down to our last 15 minutes or so. So I'm going to go a little bit more rapid fire and ask specific people specific questions. But again, raise your hand if you feel like there's something really important we're missing. Dr. Puryear, I was wondering if you would mind speaking about the fact that this virus is really not dissipating. It's just sticking around so much. Could you talk a little bit about why that might be and what we can expect from sort of the future?
Yeah, so at least I'm speaking from the perspective of U.S., specifically the northeast corner of the U.S., and it first landed on our doorstep late 21, early 22. And when it first came in, it was kind of broadly reactive. We had all the things for a long period of time. And then it settled into more of a rhythm. And I think a lot of that has been with there being kind of a rollout as it's gotten into more species that it has amplified through the ecosystem. Sorry, my room is super, super dry right now.
No worries.
All right, so as it first came in, we've had lots of waves of it coming through and landing in with new species. Often we see it come in through gulls, and then it has made its way into the ecosystem and has amplified through the ecosystem in a way that has kept it present through those seasonal bursts, where we have new waves that come in, but it's already been seeded there in the more of the resident animals, and then it stays there for a period of time before that next wave comes in. And as it has worked its way kind of through the ecosystem, and the fact that we see it so frequently going neurologic, that it becomes an impact of the predator-prey relationship. So it's not just that it's shedding through the feces of the animals and being picked up that way, the way that influenza traditionally is, but it is also making the animals more easily accessible as a prey in species that wouldn't necessarily be interacting in that predator-prey relationship. So that's amplifying it through the system as well and kind of bridging those gaps of those waves of the new virus coming through. Yeah, I think that largely covers what we're seeing with the waves. I'm sorry about the coughing.
That's okay. I'm so sorry. Your throat's so dry. That's really helpful context for us. Dr. Fair, do you have anything to add to kind of like what we could see for the future of this disease in the environment?
Yeah, that's a tough question because I started working on H5N1 back in 2003 when it really actually, left the poultry in Asia and went into the wild birds. And so, that's over 20 years of trying to get the word out and doing the modeling and the prediction and pretty much it is, it wasn't immediate, but it's taken 20 years to get to this point. But everything we said would happen happened. So, I'm not that on my gravestone I will put, I told you so, but maybe I will. I will say though that out of everybody that is working with H5N1 and particularly in wildlife, that this group in particular, this group will be the ones to understand the symptoms. Nobody else sees the symptoms like you do. The wildlife biologists or, or even people just responding to an outbreak, they're going to see the mortality events and picking up dead birds. But you're the only group that will have access to actually seeing the symptoms of birds that aren't just dead. And so anytime that you can, write those up, and looking at the different species. So even a species that has a symptom this year, it may be completely different as this virus both evolves and reassorts. And so it's just mutating and reassorting every, just so quickly. And so those symptoms will also change, but anytime you have a chance to also with testing, to collaborate with researchers where they'll take a bunch of your samples and do it for free. I mean, all of that can tell us who's asymptomatic, how is it changing, and some of those would even be sequenced, which is really how we can tell how the virus is either reassorting, which is what we're more afraid of, versus just mutation. But I really appreciate everybody in this community for everything that they're doing because you guys are the front line, literally. So I appreciate that.
Thank you, Dr. Fair. Unfortunately, the "I told you so" is a little bit bitter, isn't it? Or just not a happy "I told you so." Dr. Whitmer.
To echo what was just said, and then to look at what I see in the chat, I think also there's just the difficult mental health and burnout and compassion fatigue, all of those troubles with seeing what's happening in our world. Sorry, cat trying to join. And just the difficulty of showing up year after year and trying to continue to do this work. And so I just want to say that the people are important, right? We're the emergency responders who need to keep showing up year after year to keep working. And if we try to do everything for every animal, we will have less impact in the long run. And so just a moment of appreciation for everyone, and then a moment of um, take in what you can and do what you can, and then know your limitations and your capacity. so you can come back next year and the year after.
That's such an incredibly good point and a perfect transition, because I would really love to hear from folks if so this kind of wildlife rehab is hard enough as it is, right? And then when you're faced with a big change like this, that's so far reaching, it can impact your organization's stability and your ability to continue to provide care and to continue to do the thing that you feel driven to do. And it can also put you and your program at physical risk. It's a lot to carry. That's a huge weight to add on top of what we're already doing. Does anybody have any comments, or has your program done anything to provide support? Or how do you take care of yourselves, really? And I won't pick on anybody, but if anybody wants to go first, I would love to hear your strategies for continuing this work when it's really hard. Yes, Dr. Salter.
We're fortunate in Australia that wildlife carers are recognised as first responders, so have access to mental health support through government funded programs. Specifically in the terms of the response, because we've moved into the response phase now, we have weekly briefings with multi-agency departments about the response. All of the existing channels are available for people to call for mental health support to help them deal with this incredibly challenging situation. And for us, it's been 7 weeks, as Simone mentioned, but it's already been a very long 7 weeks. And I'm sure you all know how long that will continue to be. As listening to you all, it's going to be many, many years for us. So we're right at that sort of first step. And we already know people are experiencing difficulties, and it's going to continue to be difficult and get a lot harder for many of us as well.
Very true. Does anyone else have anything to share on this topic? Well, I'll throw something out there for myself, which is just that it's really important to take time away from the work as well, even when it feels like it's overwhelming. No matter how big the cup you make, how big you expand the cup, it's always going to overflow. So, it's important to set some boundaries and actually make space for yourself, because if you don't, you will never have it and you won't continue for very long. Dr. Vitale. Oh, muted.
I guess a little bit of a Pollyanna moment from me. One of the things that we've learned from avian influenza internationally is that it has manifested differently in every single continent that it has arrived in, and in every single place. And we talked briefly about how the virus is very mutable. But the flip side of that is it can impact everything, but it doesn't impact everything. And so when it comes to a place, we're going to see, and this is my personal view looking at what I've seen internationally, we saw sandwich terns in Scotland, we saw dabbling ducks in North America, we saw sea lions in Argentina, we saw pelicans in Peru. So there's going to be big species impacts, but it's not going to affect every single species. And what we've been working on in Australia for years now, based on the work that you've all been doing, is where are our vulnerable populations? What is their academic susceptibility to H5 bird flu based on their taxon, their species, and so on? So where do we need to be most alert because these species are already vulnerable, or most alert because they have individual susceptibility? And how do you put that together to come up with the least bad response plan you can? And we need to be ready to pivot on that. But I think there's a lot to be said for it's not going to be everything everywhere all at once, and so we can lean into the resilience that our rehabbers have already shown through the 2019-20 bushfires, what they showed then, and the cooperation and the collaboration and the communication that grew through that is what we need to lean into now. And as people have said, be kind to each other and be realistic about your capacity.
Thank you. Those are really good comments. We have 5 minutes left, so here's what I'd like to do for this last 5 minutes. First, I'm going to hand it to Jack because I'd like him to explain to everybody what the Prevention Hub does and how to take advantage of the resource that it offers, because I think it's a really important resource. And I think a lot of you who are listening could benefit from engaging with this resource. And the second thing that I want to do after that is I want to go around and give last comments for everybody. You are free to make any comment you'd like, but I'd be really interested in hearing what's one thing you wish you knew when you first began responding to avian influenza. So, Jack, would you mind explaining to folks what the hub is and what it does?
Yeah, of course. So the H5N1 Prevention Center Hub is just a place for different centers to come together and, again, try and find the best preventative strategies to get information out to the public. Because people that are informed love birds. They love the world. Everyone understands the value that nature brings and how we need to protect it. And of course, that includes birds. So the hub is a place for these different strategies for centers to sift through them, find the best ones, and apply them on their own sites. So the general public is able to take advantage of this hub by simply, hopefully, going to any center that is involved with it, and they'll be given hopefully the best information regarding current HPAI prevention strategies, both for them and for any birds that they might have on their property. And for different centers, it's really just a support network for them to share strategies, find the best ways to get information out to the public, and hopefully make a change center by center, because we're all in the same fight here, which is to stop the virus. And that's why having communities like this is just so important. Having different places, different centers from all around the world with a united goal is so valuable and necessary, because it's a big goal that we have to accomplish. And thank you so much to the IWRC in general for just putting something like this on, because we need it.
We're more than happy to. Thank you, Jack. So I hope you all will take advantage and engage with that resource. Okay, so closing remarks. Dr. Puryear, would you mind going first?
Yeah, sure. I guess one of the big take-home messages that I would try to get across is to expect the unexpected. As was mentioned previously, it's presented differently every place it has gone. I know here in the US, we certainly did not expect that it would show up in dairy cattle and everything that has gone from there. And that did not present in the clinical ways that other species have. So really just, and it also was mentioned the other differentials of whether it's West Nile or rodenticides, but those things could also be high paths. So just keeping in mind that really just expect the unexpected.
Thank you. That's a really good comment. Dr. Rosenhagen.
So I'm going to try and be a little bit more optimistic. The thing that I wish that I had known at the beginning of this is that this is hard, right? We know this is hard. It's challenging. It's going to impose a lot of difficulties, but it really can be manageable. And what manageable looks like for you or your organization, your area is going to be different, and it's not going to be a perfect system. But we are tens of thousands of patients into this at our facility, and we have found a way to work with it. And granted, we are fortunate that we have the space and things like that. And so that's not going to be, we also don't have education animals, but it is manageable, work together. Like Dr. Puryear said, like expect the unexpected. So you have to have fluid policies and be ready to make changes. But you can get through this. You can find ways to work with this. So don't give up, and know that you have a whole community to reach out to for help if you need it.
Perfect. Thank you. Ada.
Yes. I think in real life, the HPAI will become, just like everybody say, it will be the very long-term commitment rather than a temporary emergency. So I think it's fortunately, because we are the government facility, and Taiwan's government had already take a proactive approach through the long-term surveillance of the wild bird, and even now we do the cross-species surveillance, so which provide a stronger foundation for disease monitoring. So for our rehabilitation centers. However, adopting preventive measures such as maintain isolation facility, PPE, or biosecurity protocols significantly increase our operating cost. So looking back earlier, long-term resource planning will help us to build a more systematic response for the beginning. And I think make sure everyone understand, make sure every staff or the volunteers understand all the level of risks and protect, make sure in the place have a clear protocol, also help reduce anxieties and give staff confidence when managing these cases. And I want to add something is every October, our staff will receive the seasonal influenza vaccinations. Although the seasonal influenza vaccine does not protect against the avian influenza, but it will reduce the risk of co-infection with two viruses, which could allow the virus to reassort and potentially produce a virus that spread more easier among the human. And you know, we don't have I know everybody have a different resource, but we do our best and we do the best choice at that time. So yeah, just keep going, and thanks for have this meeting with other. It's very helpful.
Thank you. Thank you. And great point about the vaccinations. Everybody keep your vaccinations up to date, please. Okay, let's see. Dr. Pierce.
Yes, I can be brief. I think I would tell myself not to panic. Like, I was really afraid of this at the start and like terrified of what the implications of a positive would be. And I probably lost a lot of sleep over it, pretty unnecessarily looking back, because as Dr. Rosenhagen mentioned, we need to take it seriously. Absolutely. We need to reduce the risk every way as possible, but we're not going to eliminate it completely. But it's something we have been able to work with.
Thank you, Dr. Pierce. I think that echoes how a lot of folks are feeling. Dr. Whitmer.
I just got to echo that. Don't panic. You'll get through it. Whatever plan you come up with on day one will look totally different 4 weeks later and then 3 months after that. But that process of evolution is going to be painful, but it will get a little bit better and it'll get a little bit easier to deal with.
Yeah. Yeah, absolutely. Dr. Fair.
Yeah, so in 2024 in September, we had a meeting in Washington, D.C., where we brought all of the heads of the U.S. agencies together. And what came from that meeting was, basically 3 ways to manage avian influenza and prevent a pandemic. And one of the top 3 ways with all of these scientists that were there and then the agencies was the air filtration. I know it was mentioned earlier, but I had no idea just how well it really works with preventing respiratory viruses between humans. But it's the same thing in any building or cruise ship, actually. So if you have a chance to look into air filtration, even if it's small ones just for rooms, whatever it is, that was something that really surprised me, and was one of the top things that we wrote a paper about. And so yeah, air filtration, it's a great way to manage it. I'll leave it on a positive note too.
Thank you. Emily Meredith.
I'm going to bring it back to the mental health side of definitely making sure you're taking care of yourself first before the animals. And I know as wildlife rehabilitators, we're all about the animals and we want to help them, but you really need to take care of yourself. One of the great resources I found, which is Australian, is the 3 green threads. And it has a little video and it talks about the ABCs of looking awareness, and I can't remember the other 2 words, what it is, but it really is helpful because it all talks about your resiliency and how you build your resiliency, because this is not a sprint, it is a marathon. And to me, mental health is a continuum. It goes up and down, depending on what you're seeing And you can feel like you're in a great place as far as that goes, and then something just knocks you down, and you have to use all your resources and get yourself back up and really focus in on your resiliency and make sure you're taking those steps to take care of yourself, whatever that is, that means to you, to take care of yourself.
Thank you. Dr. Salter.
I'll take this a little bit differently. I want to acknowledge, I've noticed there's a lot of Australians here and listening, and obviously lots of questions, but one of the challenges that, and I know there's been multiple posts in the chat about this, is sometimes vets aren't accepting birds for many reasons, and I'm not being critical of the vet practices, but it's a challenge that we are facing here, and that challenge is going to increase. We are working with the Australian Veterinary Association and directly with vets to try and increase access, but maybe I could put a question on notice for the rest of you, which we can come back to at another time, is how have you sort of dealt with that experience and worked to have increased access to provide care, whether it's euthanasia or treatment for sick and injured animals in this context?
Thank you, Dr. Salter. And let's talk about getting some conversations going about that after the event. Dr. Delia.
I don't think anything we knew before could have prepared us for this, because each of us experienced this outbreak differently. Working in emergency situations, I think, provides some important lessons when it comes to adaptability and resource constraint scenarios. But avian influenza adds certain operational constraints to these scenarios that aren't always flexible. So this poses additional challenges for the response teams. And I think this includes the possibility that we may face, and I would like everyone to think about this, but we may face emergency scenarios within another emergency, such as an oil spill compounded by the presence of avian influenza. So this is something that we never considered before, but it wouldn't be hard to foresee that it could happen one day. So I think we need to take a critical and proactive look at scenarios that can escalate in terms of complexity, so we can foster discussions that enable us to devise better and more effective response and containment measures for these episodics around the world. So I think we always need to hope for the best, but prepare for the worst. So I think that's the lesson we take from emergency scenarios that we can carry for the future.
Good point. Jack, I think it's been long enough. You probably thought of your final remarks.
Yeah, honestly, the thing I'd say, I wish I knew from the start, is that communication truly is everything. And that includes with the public, that includes with your fellow bird centers, because it might seem like it's a momentous hill, a monumental hill to get to climb, but with support from other centers, with other people, and it's really not, it's something that we can manage and we can handle, and that's very important.
Thank you. Dr. Franzen Klein.
I would echo everything that the other panelists shared. It's definitely feels overwhelming at the beginning, but you will find a way through. You will find a technique and a method and a system that works for your organization, your at-home setup. You'll find something that works. Reach out to your colleagues, lean on your friends for help, and you'll find a way, and you'll make it to the other side.
Thank you. All right, and last but not least, Dr. Vitale, would you mind wrapping it up for us?
Sure. Just to remind our Australian and Oceania audiences that, again, absolutely, this is not a sprint, it's a marathon. But at the moment, we are in the pointy end. We're in the end where everything is changing every day, and that makes us necessarily more precautionary, going with precautionary principles, going with very broad and cautious movements to what recommendations and what advice are coming out from government and from the jurisdictions. So be patient with that system. Eventually it will become a different kind of business as usual, but that's not going to happen overnight. So we need to remain really flexible and really cautious at this point with the advice that's coming out. So so be patient with the process while we figure out how this is going to land.
Thank you. And with that, that is our presentation. That is our discussion for you all. I know there's so much more to get into. Again, we will send out a resource email with the link to the recording and a bunch of resources for you. You are not alone out there. We will help you get more information. And just a huge thank you to our panelists for taking the time and sharing their just such breadth of experience and knowledge. And thank you guys. Like seriously, thank everyone who's here. And we're going to close it off there. So have a wonderful rest of your evening, day, morning, whatever. And we will see you next time.